In honor of World TB Day this year, I want to share some history of how tuberculosis was discovered, information on how TB is diagnosed and treated, and let you know how you can help achieve this global plan to end TB by year 2030. Evidence of tuberculosis has existed throughout history. It has been identified in the bones of Egyptian mummies dating as early as 3300 BC. In the 1700s, it was called the White Plague due to the paleness of the patients, and in the 1800s, it was commonly called consumption because of the weight loss associated with the disease. On March 24, 1880, a German physician and microbiologist by the name of Dr. Robert Koch discovered the TB bacteria that causes tuberculosis. The first World TB Day was held on March 24, 1982, on the 100th anniversary of Dr. Koch's important discovery. We don't celebrate World TB Day, but rather see this as an opportunity to provide the public with valuable education and spread awareness and get that much closer to achieving our current WHO goal to end TB by the year 2030. Tuberculosis is a bacterium that is transmitted from person to person through the air. When a person breathes in the bacteria, they can become infected. When the immune system is not able to keep the TB bacteria from growing and multiplying, this is called TB disease or active TB. Symptoms of active TB include a bad cough lasting for more than 3 weeks that doesn't get better, pain in the chest, coughing up sputum or blood, fevers, chills, sweating at night, weakness or fatigue, decreased or no appetite, and an unexplained weight loss. When TB is active and growing, it can spread from person to person. Overall, about 5 to 10% of people infected with TB will develop active TB sometime in their life, while some have inactive or latent TB. People at high risk for developing active TB are those who have been recently infected and those with the medical conditions that weaken their immune system. According to the World Health Organization, about 1/4 of the world's population, or 2 billion people, are infected with the TB bacteria, with more than 10 million becoming ill with active TB disease each year. Most of them live in low to middle income countries. In the United States, there are approximately 13 million people infected with TB who are at risk for developing active TB disease. The global plan to end TB is our roadmap to ending tuberculosis as a public health challenge. In addition to increasing access to TB care and support, this plan prioritizes public health prevention activities such as research and development, reducing TB-related stigma and discrimination, and expanding access to TB services through universal health coverage initiatives. These are all important steps to collectively ending TB in the world by the year 2030.